Welcome back to the deep dive. Today, we're digging into some really practical revision notes about a condition almost everyone encounters, rhinovirus.
That's right. Our mission here is to break down the key info from the source material for you. Make it really high yield, easy to digest.
Yep, covering the essentials, what it is, how you get it, symptoms, management, the works.
Basically everything the notes cover.
Yeah.
We want this to be a fast track for you to grab that core knowledge.
Okay, let's jump in. So, starting right at the top, according to these notes,
Yeah.
what exactly is rhinovirus?
Well, what's interesting is how clearly the source defines it. They're RNA viruses, part of the Picornaviridae family.
The RNA virus.
Okay. And crucially, the notes identify them as the #1 cause of upper respiratory tract infections, which, let's be honest, mostly means the common cold for us.
The common cold.
Yeah.
Right. That makes sense why it feels universal. So if it's that common, how do the notes say it spreads?
The material highlights the main ways: respiratory droplets, so
Yeah.
coughs, sneezes, and also direct contact, and touching contaminated surfaces too. It raises that obvious question. Why is it so incredibly widespread?
Yeah, good point.
And the notes offer a big part of the answer. There are over 150 known serotypes.
Wow, over 150. That's a
Yeah.
lot. No wonder you can catch colds repeatedly.
Exactly. That variety makes it tough to build lasting immunity to all of them.
So who, based on this source, tends to get hit hardest by these infections?
Well, anyone can get infected, obviously, but the notes do point out that infections can be more severe for young children, the elderly, and people with weakened immune systems.
Makes sense.
And also, your risk is higher in crowded places or just with increased exposure generally. Fits with how it spreads,
It does. Okay, so it gets in, it spreads easily.
Mhm.
But how does the virus actually make us feel so rubbish? What's the mechanism described in the notes?
This is where the source material is quite interesting, actually. The virus specifically goes for cells in your nasal passages and your upper airways.
Right, up top.
And the symptoms we feel, the stuffy nose, the sore throat, all that, it's largely the body's inflammatory response to that infection. Your body trying to fight it off.
Ah, okay. The inflammation. So talking about symptoms, they can feel a lot like other things, can't they? Flu, other viruses. How do the notes suggest telling a rhinovirus apart?
Yeah, absolutely. The source mentions that overlap symptoms can look like influenza, RSV, adenovirus, even some coronaviruses.
Right.
So differentiation usually comes down to the clinical picture, the overall presentation and the patient's history.
Just looking at the symptoms mostly.
Pretty much. Though the notes do say lab tests like PCR or rapid antigen tests can confirm it if needed, but it's not standard procedure for a typical cold.
Got it. And what about where and when this is most common? The notes mention the UK.
Yes, they do. The source flags rhinovirus as very common in the UK, especially during autumn and winter, the classic cold season.
No surprise there.
And it's specifically noted as a leading cause of these upper respiratory infections here in the UK.
Okay, so let's just run through those typical symptoms, the source list, the ones people usually get.
Sure. The notes detail things like nasal congestion, a runny nose, sneezing, sore throat, maybe a cough.
The usual suspect.
Exactly. Often a mild headache, too, and sometimes a low-grade fever. The good news is symptoms usually clear up within about a week.
Usually just a week.
For the main part, yeah. Though the cough and maybe some congestion might hang around a bit longer sometimes.
Right. So if it's mainly identified by symptoms, are investigations like those tests you mentioned commonly performed?
According to these notes, not really for typical cases. Diagnosis is primarily clinical, based on how things look and the history you give.
So generally no tests needed.
Routine testing for just a standard cold is pretty uncommon, yeah.
Okay, so if testing isn't usual, how do the notes say you should manage a rhinovirus infection? What's the treatment approach?
Right, so management, following UK guidelines mentioned in the source, is all about symptomatic relief.
Just easing the symptoms.
Exactly. Rest, plenty of fluids, using over-the-counter things if you need them for fever, aches, pains, maybe nasal sprays for congestion.
Makes sense.
But the really, really crucial point the source stresses, antibiotics are completely useless. It's a virus.
Absolutely key point. No antibiotics for a cold.
Definitely.
And wrapping up, what about the prognosis? What's the typical outcome? And does the source mention any potential complications?
Prognosis is generally very good. The notes describe these infections as self-limiting.
Meaning they just run their course.
Pretty much. They resolve on their own quite quickly for most healthy people, but Connecting this to the bigger picture, while serious complications are rare in generally healthy folks,
Uh-huh.
the notes do state that these infections can definitely exacerbate things for people with existing respiratory conditions, like asthma or COPD. It can make their symptoms worse.
Right, so an important consideration for certain groups. Okay, so that's our deep dive into rhinovirus, pulling out those key takeaways directly from the revision notes we looked at. Definition, spread, symptoms, and importantly, that symptomatic management.
hmm And understanding those core areas highlighted in the source really does give you a solid grounding.
Thinking about everything we've just covered, what's one thing that really stands out to you from this material?
I think it's maybe considering how a virus like rhinovirus, with well over 150 types, one that usually only causes mild illness, can still have quite a significant impact, especially as the notes point out, for people already dealing with other health challenges. It's a reminder of that wider context.
That's a really great point to end on, something important for you to think about. Thanks for joining us for this deep dive.